Buenos días a todos. Antes de comenzar, quisiera
Good
compartir con
morning,
ustedes
everyone. Before we start, I would
unas
like to share
instrucciones
with
sobre
you
el uso del
some
lenguaje
brief
simultáneo
instructions here on the use of
disponible durante
simultaneous
esta sesión.
interpretation available
Las
during this
presentaciones se
webinar.
desarrollarán
The
en idioma
presentations will
español
be
y contarán
carried
con
out in
interpretación
Spanish,
simultánea
and we will
al
be having
inglés y al portugués
simultaneous
durante
interpretation
toda
to
la sesión.
English and
Para seleccionar
Portuguese
el
during
idioma de
the
su
entire
preferencia,
session. To
diríjase
be
al
able to
menú Tab
select the
en la
language
parte
of your
inferior de su
preference, go
pantalla
to the menu
y
on the
den
bottom
clic
of
en
your
el icono
screen,
del globo
and
terráqueo.
please
Allí encontrará las
click
opciones
on the
disponibles:
globe.
español,
And
inglés
there
y
you will find
portugués.
the
Para
available
quien quiere
options
mirar
English,
calidad de
Spanish, and
sonido y
Portuguese
elige
to
escuchar la
enjoy better
presentación
quality of
en un
sound. And
idioma
if you
diferente
choose
al
to
original, le
listen to the
recomendamos
presentation
que
in a
la
language
opción si
different than the
desea el idioma
original,
original, este
we
permitirá
suggest
escuchar
that
el
you
audio
mute the
mezclado sin
original
sonido.
audio. You
Now
select
I will
that option
repeat
so
these
that you can
instructions in English.
be able
To
to
select
hear
your
in,
preferred
in a
language,
more
go to
clear
the
manner.
menu at the bottom of your screen and click on the globe icon. You will then see the available language options: Spanish, English, and Portuguese. For a better listening experience, and if you choose to listen to the event in a language different from the original, we recommend selecting the mute original audio option. This will provide a clearer listening experience. Ahora, para dar inicio a nuestro webinar, le doy la palabra a Janet Gija,
Now,
directora
to start with
ejecutiva de
our
FIFARMA,
webinar,
quien
I
nos
hand the
dará las
floor to
palabras
Janet Jiha,
iniciales.
Executive Director of FIFARMA, who will be giving us the opening remarks. Good morning, everyone, and thank you so much, Maria Paula, for these quick instructions and that are so important for the development of our webinar. I want to hand the floor today and welcome everyone today who is connected to the FIFARMA W.A.I.T Indicator 2026 webinar. As you know, this is our flagship study on access to innovation in health in Latin America. I'm Jana Jiha. I'm the Executive Director of FIFARMA, the Latin American Federation of the Pharmaceutical Industry for Research and Development. And I love having this space and having all of you here in this space today, because here we are going to be able to see in a very important degree of detail the results of the FIFARMA W.A.I.T Indicator 2026, a study that, as many of you know, we've done it for several years already with IQVIA to be able to measure the times of access to innovative medications in the region. And what we want is to show the challenges faced in each country in the region to be able to access to the best treatment possible right now. And what's interesting here is to see how the W.A.I.T indicator has evolved. In its first editions, we were only looking at 8 countries and 2 therapeutic areas: oncology and strange diseases. And in these 2 editions, we are looking at 10 countries with 5 therapeutic areas. And you will see this in detail in a few minutes. And starting last year, we have included an additional to our study, and it's what we've wanted to do for a while, and it's looking at the cause of these delays that we see in the region and understanding in more detail why these times are happening. And this is giving us information on what we can do and how we can advance. And I always say that this is a picture that shows us a reality that hopefully together we can address and try to resolve. And I always say, and I always insist, that when we see numbers and all these figures, we're not talking about a specific number. We're talking about human lives and families that are affected. Let's never forget that today. Oscar Kirby will be presenting the details of this study in this 2026 version, and will be helping us understand in detail what I was saying, the figures, what's happening, what are we improving, what are we not improving. Many of you know Oscar because he's done this presentation for several years, and we've had him many times in these meetings. He has over 10 years of experience in strategic consultancy for the pharmaceutical industry and life sciences, and he's currently the associate principal in IQVIA, where he leads several projects of strategic global consultancy focused on value and access pricing strategy, evidence optimization, and planning of launches. And after Oscar's presentation, that I'm sure we're all going to enjoy, we're going to have Vitor Nasiben as he's co-chair of the Access Group of FIFARMA and senior director of access to market for Johnson & Johnson, and he will be helping us introduce the panelists and moderate a panel that we have prepared, because I think that we all have to talk about this and give a conversation and be able to break down these figures and be able to give comments and the roads to follow and topics that we have to work on. I insist before I close that let's never forget that behind every figure and every indicator, there's a person, there's a family, there's a story that deserves to be heard. Every time you see a figure, let's not forget what's behind it. This is my message for everybody today. And without further ado, I hand the floor to Oscar Courtney to start with this presentation. Oscar, please. Thank you so much, Janet and FIFARMA, for this space. I will be sharing my screen. Please, just a second, and we can start. And as Janet mentioned, I am presenting a snapshot, a picture of what access looks like nowadays in Latin America. And this picture is for you to understand what's behind this, what's inside this. This brings together 12 years of innovation. And we're talking about innovative medications that have been launched to global markets. And what we want to see is how this launch is translated into our region here in Latin America. I'm based here in Mexico, and I've been here for 10 years. I'm originally from Australia, so I apologize if my accent comes up a bit. Um, and our sample includes 443 molecules launched between 2014 and 2025. We are including 10 countries in Latin America, looking towards number 11 for next year. And this includes approximately 80% of the new active substances that have been launched in the past 10 years in global markets. And here you can see the breakdown. We have done this study based on IQVIA information in IQVIA. We align this with FIFARMA, local associations, pharmaceutical associations like AMIF, Interpharma, AFIDRO, etc. And also with labs doing an additional validation so we can have more robust data to be able to do the study. And this year we've done interviews from the public sector with former ministers of health for an additional perspective to be able to contribute to the study. So without further ado, I will be going into the results. And something that we listen to consistently is this perspective that we're seeing today will be highlighting a lot of challenges in the region. However, it's an optimistic perspective, yeah, because what we measure in the study is an access that is declared in paper many times, but we know that beyond that, the access and additional challenges that a patient faces in accessing a new treatment are still ongoing. There are challenges of cost or challenges on availability at the pharmacy and accessing the physician. And these challenges are amplified in a rural context versus a urban context. So, this is a perspective beyond that, and the reality that the patients face can be even greater. So, I invite you to reflect about a question, and it's how can we improve health? What are the areas, and many of us here, if we practice in the industry or in some aspect of health, reflect upon this in our daily context. And it's how can I improve the health of my patient? How can I improve my health? How can I improve access to new medications? How can I develop new medications? And we are going to be exploring this around access. And I'm going to be showing these slides very quickly. I invite you to go to social media and the page of FIFARMA to download the full report to be able to digest the figures easily after the presentation. But we recognize that the burden of disease is changing. 30, 40 years ago, what was representing a bigger burden in many countries were communicable diseases, infectious diseases, and nowadays this has been going down. This has been going down because of medications and implementation of programs, etc. But today we see this part, we see the non-communicable diseases. Um, that is the same. And towards the future, towards 2050, it's projected that the pattern will be followed and that many of these same diseases that are represented here, um, like the ones with a higher burden, will still be the same ones, even though the treatments are constantly being developed to be able to treat these conditions. We see a trend here in Latin America. What you see here represented in the bars are molecules or medications that have been launched globally versus the ones that are approved in some country in Latin America. And we see a very clear trend. We see the blue ones, which is Latin America, that are coming down. The more recent the medications are, and we see in the global market, we see this going up. So more medications are being developed and launched to global markets. However, we see them less reflected in our environment here in Latin America, and being approved, and this as a first step to access. So this trend is even more challenged when we talk about more complex molecules. A medication to get to a breakthrough for a patient nowadays, many times technologies are more complex, but even breakthroughs can be greater. We see a trend towards a greater complexity of medications in 2020 and onwards compared to 2014 to 2019. Uh, but so this complexity is not only translated into development, but is also translated into challenges or additional steps that can be added or can add to processes of assessment, incorporation, and technologies into health systems. So if there are more medications and they are more complex, and the challenges are going to be greater. And we have to adapt. We have to act today to be able to adapt and improve processes and collaborate to find solutions that lead us to a more sustainable access in the region. So the disease burden has been evolving, but we have projected that this will that the diseases with a greater burden will be the same by 2050, and there's medications to address them and treat them. However, they're not arriving. Um, the trend will be more medication, more complex. Uh, but like, what is the access like today? Does it satisfy the future needs, or are we um, just keeping a system that is falling behind? So in the region, we recognize that there's very different health systems. Each one is unique. And through our methodology, we have developed a way to compare as much as possible. We developed a local definition for each country, unique to each country, of what medication availability means. And we homologate or harmonize this to be able to make some comparisons in the way um, that is more practical possible. So we have 5 categories, 5 colors that we're going to be repeating along the presentation. Red, like dark red, is not approved, no availability. So it means that the medication does not have any registration fees sold in the country. The pink means that it's approved by the regulatory agency. However, there's no availability in the private or public sector. The zebra category, which are the black and white lines, means that a medication has access, but it's only exclusive to the private sector. The public sector and most of the population does not have any access. Now, yellow and green mean some degree of access in the public sector. Yellow means that it has a limited availability. It's limited to some sectors or to some parts of the therapeutic indication. There's a limitation. So not all the patients that could have access to the medication have it. And the green one means that there's a reimbursement decision for the greater population in the country. So what we're measuring is through these categories is what is the rate of availability? How broad is the availability for a medication? How long does it take to get to that level of availability? How has it evolved in time? And how are they improving year after year? How does it change our picture year after year? And this is the index of improvement. So at high level in Latin America, we see that for the 447 molecules that are in the study, approximately 60% have approval in at least one country in the region. One country at least. It can be more, but in many cases, it means exclusively one or two countries that have approval. And that as a first step to access. Approximately 49% have availability, even if it's private or public. Again, in at least one country. And 34% have availability in the public sector in at least one country. So a third of the new medications, innovative medications that represent breakthroughs for patients are translated and have a degree of access in the public sector of at least one country in Latin America. And in a few moments, we will see how this changes and the contrasts that are important that exist within the region. We recognize that one of the main factors in bringing this innovation and being able to grant a certain degree of access to the country is public investment in health and in pharmaceuticals and medications. And in Latin America, it's the total average public investment in health is below the target for approximately 2%. It's an important delay. And if there is no investment in health, we are going to see different results than what we see in other countries. Taking this further, when we see the investment in new medications that represent one of the main weapons against the burden of disease, against for diseases for patients, we also see a delay that is even more important. It's less than half of what we see in the OECD countries with a similar sample of these same molecules that we see on the weight. We see differences per country on how this spending in medications is translated. However, we only have one country that is slightly above the OECD average, and most of the countries are way below. So we see an important challenge here that is the investment, and this will be one of the main challenges. However, it's not the only one in being able to grant access to new medications. What we listen to as a repeated theme is that health does not seem to be a priority. It's viewed more as a burden, as an expense, more than an investment. So we don't see the potential that it has for population and the economy, and it leads us to a low level of investment in these aspects. And this is seen clearly, even when we see the level of access For new medications, that's where we see the results. We see that versus a regional, where we mentioned that 33% of the molecules have access in at least one country. We see that there's important contrast between countries. There are some countries, as we see here, Argentina, Brazil, Mexico, and Chile mainly, that have a strong dependence on the private system to be able to give some sort of access to medications that are novel, while the public sector is approximately half of what the country or what the medications in the country that have access. We see a contrast in Peru and Colombia where most part of the access is in the public sector, which is a positive trend. However, less medications have access, and many of them have a limited access, meaning it's not for the entire population that could benefit from this treatment. And the third part, which is important to highlight here, you see above each bar of the country, a red dot with a number. And this red dot represents the medications that are approved for sale by the regulatory agency, meaning they are eligible to then be able to grant access. However, in many countries, there is a very important gap between the ones that are approved and the ones that have some degree of access. And we see this more clearly in Brazil, where we have a number of 219 molecules approved. However, there is a huge gap between the approved ones and the ones that have access. These are some of the trends that we see in Latin America. If we keep digging in further, we see important differences per therapeutic area. Not all therapeutic areas are treated exactly the same, and they all face different challenges at the moment of being eligible for access. Now, up top there is an arrow that has some numbers, and this represents the disease burden that different diseases represent under this category. From left to right, we are measuring or organizing per burden. And we see that the metabolic burden and oncology, two of the areas where there's a greater burden of disease for the health system and a greater opportunity with new medications to alleviate and reduce the burden and result in a greater possibility and potential for return on the investment in health and medications have a degree of access that are slightly above other therapeutic areas like autoimmune diseases or central nervous system neurological. However, still close to 50-60%. And this is the most optimistic perspective. This represents at least one country in Latin America, and it does not show the not approved molecules. So, where there's a greater opportunity, we do see slightly more access in at least one country in the region. However, there's a lot of opportunity yet to integrate new technologies to address this burden of disease. And we see this in a greater challenge when we see orphan diseases that can be in varied conditions, very different types of diseases, but that with very small populations, we see even more challenges in these areas, as well as autoimmune and the central nervous system. When we see the spending in these areas, we also see a very important deficiency compared to OECD in the area that represents a greater burden of disease, which is cardiometabolics. So, in investments in new medications for cardiometabolic diseases, we see much like less than half of what is invested in new medications in these developed countries in the world. While in other therapeutic areas like oncology, the gap is smaller. However, there is a lot of opportunity to keep delivering new technologies that also contribute and have a great potential to support in alleviating the burden of disease and changing lives. So, when spending or investment is insufficient, it also becomes inefficient. And this is one of the things, additional to a low level of investment, we see deficiencies that result in inefficiencies. And one of the areas that we want to explore here is the time to availability. When availability is prolonged, the disease is developed and it progresses for many patients. And then the process becomes less transparent and less predictable. And this also has an important impact for the labs that are developing and looking to sell the medications in their countries. So in Latin America, we see our average of access, the time from when a medication is launched to global markets to the point where we see it with some degree of access in the public sector here in Latin America. And the average is at around 70 months, 5.8 years. This is a time of submitting to approval, an average of 37 months, meaning a bit over 3 years, and time to availability or a decision of reimbursement or coverage of 33 months, which is a bit less than 3 years. So when we see this compared to last year, which is a stable, on the right, we see that most of the times are increasing times to approval. In some countries, we've seen improvements. So the assessment process is, in many cases, starting to improve, and the time to access is still seen as halted or getting worse, getting longer, which means that the bottleneck in reaching access nowadays is pushing towards access and reimbursement and is changing uh, in approval and better focused on this part of the process. Some of the challenges that we identified, additional to the low investment that becomes inefficient, and I have some images that are going to talk about this. And some of the areas where we've seen a greater challenge, and we've heard this along the research, is institutional capacity. Many times the processes become bureaucratic, and many times uh, there's not enough human talent to do the things as stipulated and declared. So institutional capacity is possibility to reinforce and work. And the second part, which can also take the part of tools and artificial intelligence, and nowadays there's options that exist to improve here. There's a lot of human challenges, uh, um, human talent challenges. And here in the region, we need to see the opportunity to work in these areas. And the second part is consistency and coordination. There's a lack of transparency and formality in the processes, and it becomes less predictable. And it's harder to make the investment in these processes and access for medications. And this is an important limit for the new medications to go into countries. And this is reflected in several areas of the sector. So, collaboration, transparency are remedies in this second part that it would be important to focus efforts on in the future. And the third part is competitiveness. Nowadays, there's an opportunity. The United States in the past 2 years has been focusing the view on developed countries in the pharmaceutical sector through certain policies related to medication prices and looking for greater price equity. And this is an opportunity so that in Latin America, the level of competitiveness uh, can have investment and we can take advantage of this opportunity to improve our level of competitiveness for this strategic sector to be able to bring clinical trials and to give access and obtain the benefit of this investment for these medications in the region. What we have heard as another repeated theme in our interviews is that many types it's a people problem. Um, there aren't enough incentives for the excellent talent to stay. There's a lot of very capable people, however, there's a lot of opportunities. So, what is the way of making this more attractive? There's a lot of impact that can be had in the region, and with greater investment, many of these aspects are going to go towards improvement. So, I mentioned that there were going to be some related data with the inefficiencies it can be in the systems. Um, and one of them is this graph. And I'm going to explain this very simply. And we see the year of launching of the medication. So on the left, we see medications that have been in the market for longer, and they're closer to the end of the life cycle of the patent. So 2014, 2015, 2016 are medications that are 10, 11, 12 years old in their availability. And we see that barely 60% approximately have some degree of access in some country in Latin America after 11, 10, 11, 12 years. So this shows us a cap, like where it can reach. It's not about time, it's more about capacity to incorporate these technologies. As we migrate towards new medications that are in 2017, 2018, 2019, they are medications that are a bit older and have gone through the time of availability. We know that this percentage starts going down. So 60% access in the public sector starts going down to 50%. The red part is increasing. We see more molecules that don't have approval, don't have any degree of access in the region. And when we go to the newer ones from 2020, and 2020 onwards, we see that the red part that represents the non-approved or approved but not available increases drastically. And the part of access, which is green, yellow, and zebra, is reducing also. So it's not just about time, it's but also what we see here is that these are the medications of a generation ago that are being incorporated only now. And these are old medications that were now incorporated into the system. And this is an inefficient spending because if there's new medications, there's greater competitiveness. But if they don't have access, we won't get the benefits. So this is one aspect.
Number two, we see public expenditure in medications that do not have a reimbursement decision. That means that are certain administrative processes, legal processes for these medications because the need is there. But we see countries like Argentina, we see a high expense, and there's medications that are supposed to be available only in the private sector. That means that there's public expenditure that is inefficient because it is not a negotiated price. It is not a decision that's been made, and there's a significant public expenditure where they have not had the decision. That means that this expense is not that efficient. However, this access is given because the need is there. So there are aspects, investments that can be improved and that represent opportunities. for health ministries and for governments in the region. And some latest reflections before we end. This technology, as I mentioned, which is there has been around, and there's a saturation and there's a delay in these assessment processes of new medications. So there is a queue, and it's important to know the reality, to be able to improve, and to work towards sustainable and better access. So here are the projections of several different scenarios that are focused on the future. There's a catastrophic expenditure scenario where it becomes higher because of the need and the load of the disease. And there's other scenarios where the expenditure will be increased in a manageable way together with the economy, and there's investment in health or other different scenarios. And we are at a critical time to receive and to define how to invest and how it will improve our future scenarios. So I mentioned some changes and some opportunities in a previous slide. And what we see in the last metric are changes toward the development of and innovation and technology. So we've seen in the last 3 years improvements and increasing levels in Latin America of investment, but they represent a baseline that is relatively low, where we are improving. So steps have been taken to improve. It is a positive trend, and we will continue with that. In terms of access, we have an incremental trend. So similar to what we've seen in the last 2 or 3 years. And we've seen 7% of the molecules that have improved access versus last year versus the picture we took last year. So this represents all the approvals or the molecules that were approved and had some sort of success. Now, about a large percentage, 40-50% are new approvals. Others are enhancements that are on the way. So they have access or without access to private and access to public. And now, in terms of access, these are incremental improvements. But when these points have come along, more than sustainable access, it's an investment in health that begins to provide more of a return on that investment. And it has to be a more accelerated improvement. So this requires a reassessment of technology investment and mechanisms to be able to make this investment effective. It requires cooperation, integration, and planning. Looking towards that future landscape where there are many more opportunities, but they require also strategic planning in cooperation with the different players in the industry. So here we're going to go to the dialogue, and this is the intention. But if I summarize briefly, here, this is increasing, innovation is increasing, the illnesses are also increasing, but they're relatively constant in terms of what are the diseases. And there's an opportunity. There's many, many opportunities, many new technologies that are more complex, and there's a possibility. So the bottleneck is the access in the region to this technology. Some of the root causes include investment and efficiencies in this investment to new technologies. And there is an opportunity today, considering the geopolitical situation and the technologies that exist outside of these AI and others. So to foster cooperation and to improve this landscape in the future. Thank you. And I would invite you again to go to our page in FIFARMA, the full brochure, because there's a lot of information that we barely touched upon today. Thank you.
Perfecto, muchas gracias, Oscar. Bienvenidos todos a esta segunda
Thank you and
etapa de
welcome
este
to this
debate.
second stage of the
Buen día.
process.
Quería
Good day.
primero agradecer ahí de forma oficial Oscar y también a
Uh,
IQ por
Thank
agrandarnos
you,
y tener la
Oscar,
comprensión de la
and everyone,
complejidad que es el tema de
uh,
access en
for
Latinoamérica. Creo que
understanding access
pudimos
in
comprender
Latin
visualmente
America, and
los
we
factores
were
que
able to
impactan
understand
de alguna
the
manera el
players that
trabajo
are
de
impacting in
renovación
one way or
médica,
another.
pero los factores que ojalá estas discusiones y debates
And these
ayuden
discussions
que
and
generen
debates have
algún nivel de
helped
emoción y
to
avance.
create some
Viene discusión
progress
en el
and a
Congreso
level
algo
of
muy importante, por
excitement. And
detrás de
something very
cada uno de
important to
estos
mention,
números,
uh,
indicadores, tenemos personas,
and
pacientes,
we have
gestores,
patients'
también
stories,
retos
and we
administrativos de
also have
países, muchos
administrative
retos
challenges, many
La
challenges
plata, de budget, de
in the
financiación
budget
que
and
podemos
financing
enfrentar como
that we could
sociedad y cuanto
face with
más
the society.
informados,
And the
seguramente
more
más eficientes
informed we are and more
estaremos
efficient,
en avanzar
we
en
will
esto en
be
el futuro.
advancing in the
Estos
future.
resultados que acabamos de revisar
These
nos
results that
demuestran
we
claro que la
reviewed
región
in the region,
ha avanzado
uh,
en algunos frentes, que
here we've
existen
advanced in
desafíos
these fronts,
importantes, ¿no? Para
and they
garantizar
have
que la
some
innovación llegue de
important
manera
challenges
oportuna y
for
también
the information to
efectiva a
reach in
estos
timely
pacientes en
manner.
Latinoamérica. A
And
continuación,
so
nosotros vamos a dar paso
we
entonces a un
are
panel
going
en
to
donde vamos a discutir esto con algunos
speak
invitados
with some
un poquito
guests
más
and
de
a little
profundidad
more
y también
depth,
para expandir perspectivas. La
and also
idea
to
es poder
expand perspectives.
agregar,
So the
traer
idea is to
visiones.
add and to
Como vimos en
bring
el estudio, tenemos
visions, as
10
we said in
distintos
the
países,
uh,
múltiples
uh,
sistemas de
we have
salud, opiniones de
the study
industrias de
has
la
10
salud.
different
Cuanto más
countries,
personas y
different
perspectivas
ministries, and the more
podemos
people and perspectives
abarcar e
we can
incorporar,
cover and
seguramente
incorporate,
más
the
soluciones
more
seremos
solutions
capaces
we
de
will be
pensar como
able
sociedad
to
para seguir
provide as a
avanzando.
society.
Mi nombre es Víctor Nasiben, yo soy el
So my
co-chair
name is Vitor
del
Nasive.
grupo
I
de
am the
Value-Added
co-chair
Innovation
of the
de
group of
FIFARMA y
innovation
estaré
at
acá
FIFARMA, and
acompañando
I
este
will be
debate y
here
ofreciendo acá
accompanying this
perspectivas también
debate
en esta discusión.
and these perspectives
Vamos
on
entonces
this
a
discussion.
invitar a este
So
panel que nos
we are going
acompañen
to
Alejandra Toro,
invite
al
Alejandro
doctor
Toro,
Arnaldo
Dr.
Marín y la
Arnaldo Marin,
doctora Astrid
Dr.
Salcedo.
Astrid
Yo
Salcedo.
voy a hacer una pequeña descripción de los
I'm going to give
currículos de
a
cada
brief
uno de ellos. Muchas
description
gracias por unirse
of
a
their curricula.
nosotros
Thank you for joining
en
us
este debate y en esta
in this
discusión.
debate, in this
Y
discussion,
enseguida yo les
and
daría a ustedes con algunas
I
preguntas para que
will
podamos
ask you some
expandir acá la
questions so that
discusión.
we
¿Ok?
can expand in each one
Alejandra
of these.
Toro es
So
una líder
Alejandro Toro
colombiana, fundadora de la
is a
corporación
Colombian
Luz
leader,
Rosa,
founder of
organización dedicada
a
al acompañamiento de pacientes
corporation
con cáncer y la promoción de
dedicated
mejores
to
soluciones de
the treatment
atención
of cancer
oncológica en
patients and
Colombia.
oncological, improving oncological
Cuenta
care
con amplia
in Latin America.
experiencia
She
en la
has broad
defensa de
experience
los derechos de
in
los
the
pacientes,
advocacy of patients'
participando en
rights,
espacios nacionales e
participating in
internacionales para
national and international
visibilizar
spaces
las
to
barreras de
make
acceso, la
visible
importancia del
the
diagnóstico
barriers to
temprano
access,
y la
early
necesidad de
diagnosis,
garantizar tratamientos
and to
oportunos.
guarantee
Es
timely treatment.
cofundadora del
She's the
Nodo Rosa,
co-founder
una
of No
iniciativa
Rosa,
regional que
a
articula
regional
organizaciones de
initiative
pacientes en
that
Latinoamérica
is working with patients
para
in Latin
impulsionar la
America
innovación terapéutica y fortalecer
to
el
work
apoyo
with
a
innovation
los
and
pacientes
therapies,
con cáncer. Su
strengthening
trabajo se ha
treatments for cancer
enfocado en la
patients. Her work has
educación,
been
la
focused
prevención y
on
la
education,
construcción de
prevention,
sistemas de
construction
salud
of
más
health
centrados en las
systems,
necesidades de
more
los
focused
pacientes.
on the needs of the
Bienvenida, muchas
patients.
gracias,
Welcome,
Alejandra.
Alejandra.
El doctor Arnaldo
Dr.
Marín
Arnaldo
es
Marin
médico
is
cirujano,
a physician,
especializado
surgeon,
en oncología médica con
and
enfoque en cáncer de mama
here
y medicina de precisión.
we have this
Actualmente se desempeña como
precision
oncólogo
medicine and
clínico en la
performs
clínica
as
MEDS.
clinical oncologist
Además,
at
es
the Meds
profesor
Clinic
asistente en la
and
Universidad de
also
Chile y
assistant professor
director
at
regional
Chile
para
University and regional
Latinoamérica
director
de
for Latin
IA y
America
Salud en
of
MIT General Clinic.
health at MIT
Su
General Clinic.
trayectoria incluye
His
formación en
trajectory includes
instituciones de
training
prestigio
and
internacional
prestige,
como
international
Hospital
prestige
Clinic de
in
Barcelona,
Hospital Clinic of
Houston Methodist
Barcelona
Hospital y
and
programa conjunto de
programs, joint programs of
FDA-ACR,
FDA, and
combinando experiencia clínica,
combining
investigación,
clinical
innovación
experiences,
e
innovation,
inteligencia artificial
and
aplicada a
AI
la oncología.
applied to
Bienvenido,
oncology.
muchas gracias.
Welcome and
Por
thank you.
final, la doctora Astrid Salcedo es médico
And finally,
egreso de
Dr. Esther
de
Salcedo,
la
she's a physician from
Michoacana de San
Michoacán
Nicolás de
University
Hidalgo
San Nicolás
especialista
de
en
Hidalgo,
medicina
a specialist
interna
in
por la
internal
Universidad
medicine
Nacional
from the
Autónoma de
National
México.
Autonomous
Muchas
University of
gracias,
Mexico.
doctora
Thank
Astrid.
you,
Bienvenida
Dr.
también a nuestro
Astrid,
debate.
and welcome
Voy a
to our
empezar
debate.
con
I'm going to start
Alejandra,
off
que
with
traerá una primera pregunta para que nos
Alejandra
traiga su
to bring a
perspectiva.
first
Algunos
question on the
mensajes clave del
perspective. Some
estudio
key
es
messages
la
from the
importancia
study
del acceso
are
oportuno.
the importance of
Desde
timely
su experiencia
access.
trabajando
From
con
your
pacientes
experience working
oncológicos,
with
¿qué
oncological
impacto
patients,
tiene el
what
retraso en el
impact is
diagnóstico
there in the
y en el inicio
diagnosis
del
and
tratamiento
the
sobre la
beginning
vida de los pacientes y sus
of
familias?
patients' lives
Bueno,
and their
muchísimas
families?
gracias por esta invitación. A
Thank you for this
Janet y a todo su
invitation.
equipo, mi
Uh,
agradecimiento siempre
and
por tener
my
en cuenta a la
gratitude
sociedad
for
civil y a los pacientes.
considering civil society and
Creo
patients.
que el
I think
diagnóstico
that
oportuno es vital,
timely
pero el
diagnosis
acceso
is vital,
oportuno es
but
aún más
timely
vital,
access is even
porque tener
more
un
vital
diagnóstico
because
cuando una paciente
having
llega a
diagnosis when
tiempo
a patient
y se atrasa
reaches
en
and
acceder a un
is
tratamiento,
delayed
pierde
in
todo
access to
lo
their
que ganó
treatment, they
llegando
lose
a tiempo
everything
para
they've won
empezar un
in terms of
tratamiento.
time
Entonces,
to start
cuando
a
en mi
treatment.
país
So
una paciente llega a tiempo
in
en un
my
estadio 1 o
country,
2A,
when you
pero
have
se
a
demora
stage
6 o 7 meses
1
a
or
acceder
2A,
a su
it takes
tratamiento,
6 or 7
o ya la
months to access
enfermedad
their treatment.
avanzó a
So
un estadio que
here,
ya todas esas posibilidades terapéuticas
all
no
these
van a ser
therapeutical
las mismas.
possibilities will not be the
Entonces,
same.
en Colombia estamos
And in Colombia,
muy enfocados a que
we're very
tengamos
focused
diagnósticos
on having
oportunos y correctos, porque
timely
ahora hay que tener
diagnosis
diagnósticos
because
oportunos y
we
correctos,
do
pero
have
que el
them,
tiempo
and
para
the
iniciar
time
el
to
tratamiento es
start
vital,
this treatment
que
is
no puede
vital.
pasar
So,
más de 30 días para iniciar un tratamiento,
uh,
que no haya
starting
interrupciones en los tratamientos
in
es
30
vital,
days for a treatment,
porque
that
si
there's
una
no
paciente
interruptions
tiene
in
un
these treatments, because
protocolo de
if a
atención
patient has a
en su
protocol for
tratamiento
attention
cada
in their
21 días
treatment
y se lo pone cada
and
3 meses y después vuelve y se
it's
lo
every
pone
3 months
y
or
después se
so,
demora otros tres
and
meses en la
it
tercera
takes
quimioterapia,
this much
pues no va a
longer,
tener la adherencia para
then
poder salir avante de esta
they won't
enfermedad.
have
Yo
the
siempre he dicho
enough
que
care
yo soy
to move
el
forward with
resultado
this
más
disease. So I've
exacto
always
y
said that I
perfecto de
am the most
Dios
perfect and
porque
exact
llevo
result of
20
God.
años en remisión
I've been
de
for
cáncer de
20
mama y no en un
years
estadio tan temprano,
discharged
estadio
from this
2B,
breast cancer in
donde
a
todo
stage
fue tan
2B.
exacto y
It was not
perfecto
that
en
early,
mi
and
línea
everything
de
was so
Journey,
exact and so
que estoy
perfect
aquí gracias
that
a
I'm
Dios
here,
y a
thank
la
God, and
excelencia
to the
de los
excellence
médicos tratantes,
of
a la
the treating
excelencia de una,
physicians and
de una salud que puedo acceder
the
a ella
health that I could
y que todos
access,
mis tiempos fueron
and
perfectos
that all
para
my
poder
times were
tener un resultado
perfect
maravilloso.
to have a
Hacer las
marvelous
cosas
result.
bien
So
desde el inicio
to
es
do
el
things right
éxito de
from
un
the
paciente
beginning is the
oncológico.
success of an
El tiempo
oncological
es
patient.
vital y es
Time
oro
is
en un
vital, and
paciente
it's
oncológico.
gold
Y
in an
ahora
oncological patient.
y ahora tenemos
And
1000
now
herramientas
we have a
que
thousand
pueden
tools
acompañar
that
un
could
diagnóstico para
accompany that
acceder a los
diagnosis
tratamientos
to
indicados y
access the
personalizados
right
para que
treatments
el paciente
and
tenga
for the
mayor
patient
sobrevida
to
libre de progresión.
have better
Para mí el
survival
acceso es
rate
vital,
free
es
of the disease.
importantísimo
And
en un
this is
paciente
vital
y
in a
marca la
patient,
diferencia entre
and
la
this
vida y la
sets the
muerte.
difference between life and death.
Muchas gracias. Seguramente
Thank you very
creo que no
much.
solamente viene de tu propia
Maybe this
experiencia,
does
pero
not
debe de
come
servir
from
muchos
only from your experience,
pacientes
but also
y
from
ver que
following
esto en
many
realidad es
patients.
lo
And
más
I think
importante, ¿no? Tener
this is the
este
most important, and
acceso a la tecnología o a la
access
solución
to
que el paciente
technology.
necesite. Desde esta
And
perspectiva,
from this
danos un
perspective,
poquito más de
give us a
visión
little bit
sobre
more
cuáles
of
son o lo que tú consideras que
what you
son
consider
actualmente los
are
principales
the
retos
main
del sistema de
challenges
salud
of the
colombiano
Colombian
para
health system
garantizar este acceso
to
oportuno a
guarantee
las
this
terapias
access
oncológicas
around
innovadoras.
oncological therapy.
Mira, yo soy una
Well,
abanderada de la
I
innovación terapéutica y diagnóstica
am
porque
a
creo que
messenger
ahí
of therapeutical and
está
diagnostic care
el
because
éxito
I,
de
I
poder disminuir los
advocate
costos en
for
los
this
sistemas
because
de salud
I think that is the
y poder
success of reducing costs in the health systems
aumentar la
and to
posibilidad de los
increase
pacientes.
the
Creo
possibility of
firmemente en
patients.
eso,
I believe
pero
firmly in
desafortunadamente en
that.
mi
And
país
unfortunately, in my country,
el desconocimiento
the lack of
para navegar
knowledge to
en los diferentes
navigate
sistemas de salud
uh,
es enorme. Los
is
pacientes cuando los
enormous.
diagnostican con una enfermedad ni siquiera sabe cómo
So
iniciar
when
su
an illness is
proceso y
diagnosed,
eso se
they
demora
don't even know how
muchísimo.
to start the
Las
process, and
trabas
that takes a long time.
administrativas son enormes porque la fragmentación del sistema de salud
So
en
the
Colombia
fragmentation in
es
the health
muy grande
system
y
is
muy
very
grave
large, and it's
porque
very serious
no
because
está todo en un centro de
it's not all
referencia o
in a
especializado o de
reference
excelencia
center
donde el paciente se puede
where
hacer
the
todo
patient
su
can
tratamiento,
do their whole
sino que lo
treatment,
mandan de un lado a
but
otro y pierden
they
muchísimo tiempo
send them from one
mientras
side
se
to the
hacen
other.
unos
But
exámenes, mientras le autorizan otro
Here,
examen mientras le autorizan la quimio.
while
Entonces, un paciente puede
chemotherapy is
perder
authorized, etc.,
muchísimo tiempo en
a
esta
patient could lose a
tramitología.
lot of time
Y
in this
además
in these
tenemos una geografía
bureaucracy,
enorme
and
y
we also
diversa.
have an
Entonces,
enormous
en las
and
grandes
diverse
capitales
geography.
tenemos una
In the large
capacidad
capitals,
muchísimo
we
mayor
have
para atender a estos
much more
pacientes,
capacity
pero cuando estos pacientes
to
viven
address these patients. But
en zonas
when
apartadas y
these
rurales,
patients live
pues
in
se demoran
remote
muchísimo para
places,
poder acceder
it
a los
takes very
tratamientos.
long for them to
No
access
todos tenemos esa equidad en
these.
Colombia.
We don't
Los
all have
diferentes
that equity in
regímenes de
Colombia.
atención
There's different
hacen la
regimes of
diferencia
attention that
grandísima y
make a
abismal de
difference
poder tener
of
éxito
how
al
to
final
be
del tratamiento.
successful.
Un régimen
And
subsidiado,
so
un régimen
there's a
contributivo
subsidized
y una
regime,
póliza
and
define
this
categóricamente
defines
cómo te va a ir a
categorically
ti en el futuro.
how you're going to do in the future.
Excelente. Muchas gracias, Alejandro, por tu perspectiva.
Muchísimas gracias,
Thank you for
doctor.
your perspective,
No, a
Alejandro.
usted. Vamos a
Thank you.
movernos entonces al doctor
Now
Arnaldo,
we're going to
que
move to
quería
Dr.
tener acá tu
Arnaldo,
perspectiva como
and
médico
we have the
especialista en la área
perspective
y
with
escuchar en
specialists in the area,
oncología, en
and
las
to
guías de
understand in
evidencias científicas
oncology,
nos señalan a
the
cuál es el nivel de
guides
evidencia de cada
point
una de estas
to the
terapias que
level of
innovadores
evidence that
traen
each of these
y las
therapies bring,
oportunidades de
and the opportunities.
monitorización o
And
mejorías en los estándares de cuidado para los
here,
pacientes.
for the
Cuéntenos desde
standards
tu
of care of the
perspectiva,
patients, tell us from
¿con
your
qué frecuencia
perspective,
los médicos
how
deben apartarse de la
frequently should
alternativa para
physicians
considerar
take the alternative to
clínicamente
consider
ideal y tratar el
clinically
paciente con lo que hay?
the
Lo que quiero
patient
decir
with
es,
what
tenemos
they have?
diferentes
What I mean is,
innovación llegando,
we have
tenemos
innovation
a
coming
los
in, we
médicos
have
revisando estas
the
evidencias
physicians
con
reviewing
una
the
grande
evidence
perspectiva
with
positiva
a
sobre la
large
adopción de
positive
mejores
perspective
opciones,
on the
pero
best
muchas veces
options,
se enfrentan con
but
la
many
necesidad de
times they're
tomar decisiones
facing
sobre lo que está
decisions
disponible.
on
¿Con qué
what is
frecuencia
going
esto
on.
pasa y qué
How
consecuencias
does this, or
este
how
tipo de
frequently does this
decisiones tienen
happen?
para
And
el
how do these
diagnóstico y
decisions
pronóstico del
uh,
paciente?
take care of this prognosis for the
Bueno, muchas
patient?
gracias por la invitación
Thank you for the
para poder
invitation
conversar un poco de estos
and
temas.
to be able to
Por
talk about
desgracia,
these
este es un
topics.
tema muy
This
relevante,
is a
al menos
very
en mi
relevant
país. Yo,
topic,
como ya mostraron en
at
el
least in
Zoom,
my
pero muy
country,
probablemente en
uh,
Latinoamérica,
in Latin
respecto a
America,
lo que es el
with
acceso.
regard
Tenemos grandes
to
problemas de
access.
atrición,
We
así se
have some
llama el
attrition
concepto
problems.
médico,
That's
donde
the
el paciente no es
medical
capaz de
concept
llegar a
where
una
the
segunda línea
patient
o otra
cannot
línea de
reach a
tratamiento
second line of
por un tema,
care.
digamos, de
So
tiempo y diversas
this is a topic of
dificultades. En mi país no es
difficulties.
infrecuente que estemos
And
en esta circunstancia, a pesar de que una
in my
droga
country,
innovadora
it's
tenga
difficult
una
for this
magnitud de
innovation
beneficios
to have
clínicos
a magnitude
cuantificada
of
muy
clinical
buena.
benefits,
No
and
está regulatoriamente todavía aceptada para su uso
regulatorily, it is not yet
en
accepted.
pacientes, sobre todo del
Uh,
mundo público. Tenemos brechas muy
Especially,
importantes entre lo
we
público y lo
have
privado
very
en este
important
sentido.
gaps between
Y
public and
ahí
private.
nos vemos en un problema,
So
y no
that's a
menor,
problem for us.
y de alguna forma también los estudios
In a
clínicos
way,
son una
clinical
oportunidad para el
studies are
mundo
also an
público,
opportunity
en donde no está cubierto el
where
acceso de esa droga
access
para los
to
pacientes.
these
Vemos no
medications is
solamente el
not covered.
beneficio en
Not
sobrevida de
only the
pacientes
benefits in
metastásicos, en
survival rate,
calidad de vida,
in quality of
en
life, and in
tolerancia,
tolerance,
digamos
and
también. Entonces,
also
es sumamente
this is
importante
very,
enfocar
very
a
important,
que cualquier
this gap.
acercamiento
And
respecto al acceso en
what
pacientes,
we see with
en el
access to
caso de mi país,
patients,
en el mundo
in my
público
case,
y
in
el
my
mundo
country,
privado,
in the private and the public
y que
worlds,
regulatoriamente no está
because
aprobada. Y otro tema
regulatorily
que no es
speaking, it
menor
is
es
approved.
el
And
accionar que a veces
I wanted to mention that
cuando se aprueba una droga en mi país desde el punto de vista
here
público, no se hacen salvedades porque hoy día
there
sabemos
is
como que
no
hay algunas drogas que, pudiendo
caveats made,
pertenecer a la
because
misma clase, no tienen necesariamente el mismo nivel de
they
evidencia
don't have the same
y a
level
veces
of
se dejan a
evidence.
todas
And
aprobadas de la misma manera.
so
Entonces hay que ser un poquito
in the
más fino a la
same
hora
on the same token, you have
de
to be a
poder
little more
mediar
detailed
estos
in
fenómenos.
terms of
Un tercer
putting
aspecto
this
que me
into
parece
perspective. A third
relevante
aspect
mencionar, que en mi
that
país
is important
tenemos
to
brechas
mention.
diagnósticas todavía. Muchas de estas drogas
We
no
don't have
tienen un
diagnostic
proceso
tools yet.
diagnóstico para
So
su uso.
uh,
La búsqueda de un biomarcador
for the search of
específico,
a biomarker, for
y en
example,
mi país tenemos
and
dificultades de acceso a la secuenciación, por
we
ejemplo.
have
Si uno
sequencing as
quisiera
well.
dar una terapia
So
dirigida, requiere de una secuenciación
this
para poder
requires
identificar
sequencing
esa
to be able
alteración
to
y que el
diagnose
paciente
this
pueda acceder.
alteration. And
Entonces, tenemos elementos diagnósticos de brechas, tenemos
so
brechas
we
a
have
nivel del
diagnostic
sistema
and
público y
gaps.
privado,
We have
y de la forma también en cómo realizamos
and
la
how
incorporación a veces de
we
la droga en el mundo público,
incorporate the
que va
analysis
con una
of the
lentitud
medications that
significativa
are going
respecto a cómo se
significantly
va subiendo
slow,
la evidencia.
and how the
Entonces,
evidence is being used.
Muchas gracias
Thank you very
por esta
much
perspectiva,
for
doctor.
this perspective,
Tuvimos un
doctor.
representante de la sociedad civil que traía un poco esta
We had a
perspectiva de la
representative of civil society
oncología.
that was
En tu visión
bringing a
de experto
perspectives
también desde la
from
visión de oncología,
oncology
esta
and
perspectiva muy
others.
importante. Me gustaría traer un
And
poco la
I would
perspectiva de
like
la
to bring
doctora Astrid,
this
que trae una experiencia
with
tal vez de
Dr.
una otra
Astrid
área
and
terapéutica, pero que enfrenta
also
sistémicamente los
facing
mismos
systemically the
desafíos para
same
poder contrarrestar un
challenges.
poco
So
y ver si en otras áreas
to
eso
see if
también
in
es
any other
verdadero.
areas
En
uh,
cardiología, doctor
they
Astrid,
can provide
muchas
information.
veces
In
el beneficio de la
cardiology, Dr.
innovación
Astrid,
está en prevenir un evento que todavía no ha ocurrido.
basically
En
we have to
distinción
prevent
a
an event that has not yet
la
occurred.
oncología, en que vimos que hay una urgencia muy grande
So there's a
por
large
enfermedades que
urgency
van a
there
avanzar de una
in
manera cada
cardiology
vez
because diseases
aguda,
keep
amenazando la
advancing
vida de forma
and
cortoplacista. Si me
to have
permite
a
acá
short
una
term, if
visión
you
un poco
will,
más simplista del
to have a more
concepto,
simplistic view of the
cómo
concept. How
estos retrasos pueden
do
afectar
these
la
delays
posibilidad de
affect
los
the
pacientes en la
possibility
área
of
de
patients
cardiología de
in the
prevenir
area of
eventos
cardiology
como
to prevent
infartos,
events like
accidentes cerebrovasculares,
perhaps uh,
hospitalizaciones
any
o
strokes or
agudización de
any
sus
type
condiciones?
of
¿Tú ves los
uh,
mismos desafíos
strengthening
que
or
vimos en
enhancement of these
oncología, acceso
conditions.
a tecnologías
In oncology, we have
distintos
access
en
to
público y
technologies,
privado,
different
distintos en
sectors,
el
public and
tiempo? ¿Cómo
private.
estos factores están
How
afectando
do
a
these
pacientes
factors
en su
interfere
realidad en México y en
in
su
their
área
reality
terapéutica de especialidad?
and therapeutically in your specialty? Thank you very much. In cardiovascular development, uh, the gap is very similar. So the access to the private part is perhaps there will be more availability. And in the public sector, it's another story. And in Mexico, there are different regions where access is not adequate. So unfortunately, uh, the patients with prevention in a tertiary area, uh, from the get-go, we try to be more timely, especially with a new therapeutic tools that we have to prevent all of these events. So the problem is not just access. We could start a medication, but the problem is continuity. So this is what we have in the clinical trials. The results are marvelous. And here, what happens in our country. So the country sometimes cannot pay for therapy that has interrupted treatments, or patients have therapy for 4 months and there's no access. So there's no prevention to this medication, so or to this illness. So this is where we have to give continuity. And I think here on the medical aspect, access to information is much more homogeneous than just the internet and AI, but also for a patient identifying, accessing, or addressing the health systems in a more timely manner, as Dr. Alejandra said, to access and to obviously in the first level of care to have timely reference of the patients, so that this is an area of opportunity to improve the education aspect and the dissemination of information and for our health systems, because continuity to and access to all the therapeutic tools is very important. Patients, if they don't have it all in their rural centers or regional centers, when they go to different areas, sometimes, even in some specialized centers, they don't have these diagnostic alerts, and some are paid privately when the patients are able to. In others, they have diagnostic tools for public centers, but it's still difficult to have homogeneous care for our
Perfecto,
levels of
muchas gracias. Y
poverty.
en este tono me gustaría
Thank you.
ir
And I would
caminando
like
para
to
un
go
cierre, capturando de usted
wrapping
esta
up
vez
and capturing from
una
you
visión de
a
una o
vision
dos
of
acciones
one or
concretas
two
que
specific
nosotros
actions
podríamos sacar en reflexión y
that
visión de cada uno
we
de
could reflect
ustedes,
upon
tomar
each of
como
these. And
próximos
so
pasos o en la visión de ustedes como acciones para garantizar que podamos reducir de
to
alguna manera la
guarantee
distancia
that
entre
this could
cantidad de
reduce the distance between
soluciones
availability of
y que
solutions
estas soluciones
and
estén en la mano de los pacientes que tanto las necesitan, pero también de los
so
médicos para que
for the
usen
patients that need
estas
to
herramientas. Vimos en
use
los
these tools.
estudios
So
y en la presentación de Oscar
in the presentation from
retos en
Oscar,
cómo evaluar estas tecnologías,
to
cómo
assess these
buscar
technologies,
financiamiento,
to
cómo
reach
actualizar
financing,
protocolos. Varios de
to
los puntos que tú
begin
estás comentando
protocols,
también
etc.
relacionada a
And
información de la
this situation
población,
with the
cómo
information,
navegar sus sistemas de
how
salud.
to
Me
work with
gustaría
these
empezar
health systems.
contigo que
So
está acá en
I'd like to
pantalla,
start
a Astrid,
with you,
de
Astrid,
uno o
here.
dos puntos
One
concretos
or
que
two
te
specific
concentraría
points
después de esta
on
reflexión que
concentrating from
vimos
this
para
reflection that we
ojalá
saw
avanzar de forma
to advance
sustancial en los
substantially
sistemas de
in
acceso
these
a
topics of
medicamentos
access
innovadores y nuevas
to
soluciones de los
innovative
pacientes. Muchas
medications
gracias.
for your patients. Thank you.
Para hacerlo corto, yo
Yes,
diría
to make it short,
difusión
I would say
y orientación
education,
en la parte médica y la
dissemination
parte de la
uh,
sociedad en general.
in terms of
Difusión,
society in
por
general,
supuesto, de esto.
dissemination meaning to society,
Por
and
supuesto que requerimos
of
una mayor
course,
inversión
we
en salud.
require more
Ya lo
investment in
decía
health. It was
principalmente Oscar
already
en su
said by
presentación.
Oscar in his
Creo que
presentation.
necesitamos mayor
I think we
inversión
need more
porque
investment
si
because
hacemos entender
if
a
we
nuestras
make our
gobernantes y demás que
governors
más que un
and
gasto
politicians
es una
understand
inversión
that more than
a
an expense,
futuro
it is an investment
y
for
a
the
futuro
future
inmediato e inmediato
and
inclusive, creo
short
que
term
esto sin
even.
duda hará la
Uh,
brecha muchísimo
this will
menor.
make the gap much smaller.
Muchas gracias por las reflexiones
Thank
y
you very much for your
mucho de
reflections
lo que tú
and
estás comentando con base en evidencias muy
from what you're
robustas, no
mentioning,
solo por
based
este
on
estudio, pero
evidence, not
muchos
just with this
otros
study, but
que
others.
en
Uh,
FIFARMA hemos
in
desarrollado.
FIFARMA, we've been able
Gracias.
to develop
Alejandra,
thanks
me
to
gustaría
the
escuchar
Alejandra. I'd
desde
like to
la
hear
representación de la
from
sociedad
your
civil, de los
representation of
pacientes,
civil
cuáles serían
society,
estos
from the patient
dos
side.
puntos que tú ves de
And
acciones
so,
concretas.
Pues yo creo que hay algo
some
muy
specific
importante que
actions,
estamos
please.
desarrollando en Colombia,
Yeah, there's
que
an
es
important point that we're
activar a los
developing in
pacientes
Colombia,
para que
which is
sean
activating patients to be
conscientes de que son,
aware
eh,
that they are
son, tienen que ser activos
they have to be
frente a sus
active
tratamientos y tienen que
facing their
conversar
treatments,
con sus
and they
médicos
have to
tratantes
speak
para
to
hacer una
their
sinergia
treating
exacta
physicians to
y tener
synergize
posturas muy
and
claras
to
para
have
construir
very
de manera,
clear
eh,
positions to
yo
build.
creo que en
And I think
sinergia, ¿qué
in
es lo mejor?
synergies, what is
Ahora, en este
best?
momento los
Now,
pacientes llegan con una
at this
cantidad de
time,
información
patients come
de la IA y de Google y de una
with some
cantidad de
information from
herramientas
AI
que
and
usan cuando los diagnostican.
tools
Pero yo
that are
pienso que la
used, but
información y la
when they're
educación
diagnosed.
de la
But I
sociedad
think the
civil, de las
information from civil
fundaciones
society,
a
from
los pacientes
foundations,
es de vital
for the
importancia,
patients is
porque
vital
les da
because it gives
manera de
them
sentarse de una
a
manera
means
diferente
to come
frente a su médico tratante
closer and
para
sit with their
consensuar qué es lo
treating
mejor para mí.
physician
Y
to have
nosotros también
consensus
estamos con
on what is
unas
best for me.
campañas muy
And
grandes
we also have some very
con
large
los médicos que
campaigns.
además están
And
con
so
una disposición muy especial y muy
they have
bonita
a
para
very
darle todo el
beautiful
conocimiento al
disposition
paciente, porque muchas veces en
to
Colombia
care for the patient. In
toda
Colombia,
la información no se le da al paciente
all the information is not given
dependiendo
to
del
the patient
sistema en el que
depending
esté
on
afiliado.
the system that
Entonces
they are
muchas
a
veces
member
dicen,
of.
¿para qué le
But
voy a
sometimes they
decir al
say,
paciente que
"What?
existe
Why
una
should I tell a
terapia
patient that there's a
si
therapy
su sistema de
if
salud no se la va a
their
dar?
health
Entonces
system is not going to give
nosotros
it to them?"
siempre le
So
decimos al médico,
we always
dile
tell the physician,
todo lo que
tell
el paciente necesita saber.
them everything
No
the patient
escatimos
needs to
ningún
know.
esfuerzo,
Don't
que desde
save
la sociedad civil
any
nosotros nos vamos a
efforts.
encargar para que el
We from
paciente
civil
reciba lo que
society
tiene que
will
recibir, ni
represent
más ni
and help the
menos.
patients
Entonces,
receive
esto es
nothing
educación
more,
del
nothing less than
paciente
they're supposed
para
to.
que esté
So
más activo y más presente y
to be
tome
more active
mejores
and more
decisiones
present.
frente a sus tratamientos, tener conversaciones con los médicos siempre, porque muchas
So to
veces
have
los médicos
conversations
no es que no
always,
quieran, es que
and
están maniatados
they're
porque no pueden decir.
very their hands are
Y
tied because
también que
also
empecemos a hablar
to
no
begin
desde
to speak
visitar al
from
médico desde la
the
enfermedad,
visiting the physician
desde
from
cuando
their disease,
existe el
but when
síntoma,
there's a
sino
symptom,
que
but
empecemos a normalizar
to begin
ir
to
al médico
normalize
desde la
the
normalidad
fact of
de
going
nuestro
from to the
cuerpo.
doctor from the
No
normalcy of
vamos al
our
médico cuando
body,
ya hay
not
síntomas
when
graves
there's a symptom
porque
or a serious
porque no
symptom,
vamos a llegar a
because
tiempo.
we're not going
El
to get there
mejor
on time.
medicamento
The
innovador
best
es llegar
innovative
a tiempo,
medication is being
pero
on time.
también es
but
tener
also
conciencia
being
de que
aware
soy un paciente
that
activo
I
frente a
am
la
an
enfermedad
active
y construyo
patient
de manera
and
conjunta con el médico,
in front of my
y el
disease, and I
médico
build
tiene la
this
humanidad,
path
la
with my
responsabilidad
doctor.
y el
My doctor has the
profesionalismo de
humanity and
decirme
professionalism
todo
to
lo que
say
yo necesito.
everything I need to know.
Eso es lo que nosotros,
And so
en lo que
this
nosotros
is
estamos
what
trabajando en
we
Colombia.
are working on in Colombia.
Perfecto, excelente, muchas gracias. Ya vemos ahí convergencia de
No,
opiniones.
es que no me pude
Perfect.
conectar desde
Excellent.
el
Thank you
computador
so
porque no
much.
me dio
No, I'm
acceso,
sorry, I
entonces
couldn't
estoy en el
connect
teléfono
from my
de este
computer. It didn't give
paisano.
me access, so I'm
No
on
te
my
preocupes,
phone,
te
and this is
escuchamos
crazy.
perfecto y te
Don't
vimos
worry, we could
perfecto.
hear you
Muchas
perfectly
gracias. Como te
fine.
estaba
Thank
comentando
you
que ya
so
vemos
much. I've been
convergencia
commenting
en
that we
tu
already saw
comentario, por ejemplo, en temas de
convergence between
educación,
your
con
company in
Astrid.
terms of
Esto me parece
education
que es
with
un tema muy
Astrid,
relevante.
and
Nos
I
interesa
think
ahí
this is
escucharlo,
very
doctor
relevant. We'd
Arnaldo,
be
desde tu
interested in
perspectiva.
listening to Dr.
Dos puntos
Arnaldo
que
from
ojalá van en
your
la misma dirección o
perspective,
se
from
suman
these 2 points that
a los
hopefully go
puntos
in the
ya
same
presentados.
direction or added
Me
to
sumo a
the
las
same points
palabras
that
de
are already
Alejandra
presented.
y de Astrid.
I
Yo creo
echo
que aquí hay que
Alejandra
poner el
and
paciente al
Astrid's
centro.
words. I
Ese es
think
el
we have to
objetivo.
put the
El
patient at
paciente
the
está en el centro de
center.
todo esto. Y
That's the
cómo hacemos
goal.
un
The
esfuerzo de
patient is
diversas
at the
entidades,
center of everything, and how
industria,
we do
reguladores,
an effort from
gobiernos,
different
academia.
entities, industry
Eso la finalidad,
regulators,
también cómo ayudamos
government,
a perfilar
academia,
mejor y a
and how
diagnosticar mejor a
we
nuestros pacientes,
help better
a darle
profile and
indicación a los
biomark
que más se
our
benefician
patients
de
so
esa
that they
estructura
can really
terapéutica
be the ones
y en
that benefit
conjunto
from the
poder solucionar
strategic
el tema de acceso. A mí me parece
um,
que es un problema complejo que
idea.
tiene
And
muchas aristas.
second, I think
Es
this is a
importante
very
la evidencia
complex
científica que se
matter
obtiene
um,
evidentemente, trabajar en
because it's
tratamientos
important to have the
diferenciales,
scientific
buscar
evidence and
mejores
work
biomarcadores para
in the
seleccionar aún
in
mejor a
this
la
and
población que
look
se
for a
beneficia.
better biomarker to
Es sumamente relevante. Yo
improve the
ahí le veo un rol
population, the
político
benefits
también
from
de
here.
esa
And
decisión
I see a
respecto a
very
poder
interesting
biomarcar
role
mejor y
in
democratizar
artificial
incluso
intelligence on how to
estrategias
biomark and
diagnósticas con
democratize
imágenes y secuenciación
diagnostic
genómica
strategies.
y por
Um,
supuesto también
and of
en poder
course,
trabajar con los pagadores en una forma de
and
hacer
being
esto
able to
viable
work with
para
the
el sistema.
payers
Entonces creo
to make this
que
viable for the
tenemos que
system.
sentarnos todos en la mesa y con disposición
So
a
we all
poner al
have to
paciente
sit
al
down
centro
on the
para
table with the
que el
willingness to
paciente se
put the
beneficie
patient
de
at the
todas
center
estas
so that the
oportunidades
patients
que
can
tiene.
benefit from the
No sé si
innovation
conocen un
strategy.
estudio publicado en el
Um,
JCO,
I don't know if you
que es
know a
una
study
revista
published at the
importante de
JCO,
cáncer hace
which is a very
un par de
important
años,
journal
en donde muestra
for cancer a
el
few years
nivel de
ago,
innovación que
that
hace la
demonstrates the level
industria
of
versus lo que
innovation that the
efectivamente
industry
hacemos
does
como académico, digo ahora como
versus
profesor
um,
universitario, y
what
estamos
we
al
do
debe
in
en
the
ese
academia. And I
proceso,
say this
cómo
as the
trabajar con
university
diagnósticos
professor.
para
And
facilitar con
we
biomarcación
are
local el
seeing how we
acceso
can work
también a selección
cooperatively
correcta
so
de
that
los
we can
pacientes para el
biomark the
tratamiento.
access and right selection of our
Y le
patients
sumo
for our
las palabras de
treatment.
la educación. Aquí no hay que
And I
negarle la
add on to the
información
words
a
of
nadie,
education,
hay que ser
we don't have to deny
transparente,
information from anybody.
prevención,
We have to be
pero el
transparent.
camino que a veces ha ocurrido en mi país, que no me
But
parece
the
el
path
correcto, que es la
that maybe
judicialización
my country has
de
taken that I
los
don't
accesos,
think it's
es una
right,
muy mala
which is
política.
the
Creo que eso
judicialization of
no
access, is a
logramos como
very
sociedad
bad
enfrentar
policy.
este
And
problema de
this
verdad.
is the reason why
Creo
we're not
que
able as a
requiere de todos los
society to
actores,
face this
sectores,
problem as a whole.
industria,
Um,
pagadores,
and
ministerios,
we and require
ministerios de
all
salud
stakeholders like
respectivos,
industry, payers, ministries, respective
pacientes,
ministries of health,
academia,
patients,
para poder
academia,
tener una
um,
política más
to be
robusta
able to have a
de
more
acceso.
robust policy for access.
Excelente, muchas gracias y muy claro. Doctor
Thank you
Arnaldo,
so
yo
much.
creo que
This
tú
is
logras
very
traer
clear,
esto a
Dr.
un
Arnaldo. I think you're
cierre
able to bring this to a
muy importante
very
y
important
contundente que está muy
closing,
alineado con la
and a very
visión de este
strong closing
webinar,
that is
de las
very much
actividades
aligned
que
to the
FIFARMA
vision of
está
this
llevando a
webinar,
cabo
of
y que
the
se
activities
concentren en
that
el diálogo,
FIFARMA is
que se
carrying out, that is
concentren en educar
concentrated
a
in
todos sobre
dialogue and
qué
in
hay de
educating
información
everyone
y esta
on
oportunidad de
what we have in
identificar cuáles son los
information,
cuellos de botella
and
que
the
podemos
opportunity
trabajar
to
juntos para seguir
to
avanzando.
identify what are the
Te voy a
bottlenecks to be
agradecer
able to work
mucho
together and
tiempo,
keep
muchas
advancing.
gracias.
I want
Pudimos
to
tener
help
acá por
you
el
so
tiempo casi
much for your
220
time. We
personas
were
conectadas,
able
lo
to
cual
have
da la
almost
magnitud de
220
la
people
importancia de
connected,
los
which shows us the
temas,
magnitude of the
esta
importance of
hambre de
these
conocer más sobre
topics
lo que está
and this
pasando en Latinoamérica,
thirst for
identificar
more
esos
knowledge
puntos seguro
on
que
what's
está
happening in Latin America and
permeando mucha
identifying the
gente en
points
la
that is surely
sociedad, desde la
permeating a lot of
sociedad
people
civil,
in society.
pacientes, médicos,
Um,
expertos de la
and
industria.
and
Muchas gracias
patients
a
and
todos también que se
physicians
conectaron, a
and
Oscar de IQVIA,
industry experts.
Lina,
Thank you so
observadores
much
de
to
los de
everybody who
FIFARMA,
connected
Acá
Janet
antes de
for her leadership
finalizar,
from
me gustaría
FIFARMA
tomar
IQVIA.
el
And
mensaje que
before
es
I close,
central
I
en
would
esto,
like to
que la innovación solo
take a
genera
message
desarrollo
that's central,
económico,
that
no logra
innovation
llegar
only
o
generates
gestionar
real
nunca a los
value where
pacientes que lo
it
necesitan. Yo
reaches
creo
the
que
patients that needs it
caminando
in a
sobre este
timely manner. And I
hilo
think
es
that
que
walking
estaremos de
towards
acuerdo,
this thread that you were bringing, Dr. Arnaldo and Astrid and Alejandra, of dialogue and information and education and identifying the alternatives and the important conversations for this to be the vision and the reality is the objective that we have here. We were already able to do this in the studies. Now, hopefully, we have to research and identify the bottlenecks that are with the governments, with the health systems, and how we can help professionals to keep advancing in their knowledge and mainly keep guaranteeing that this is a multilateral universe for dialogue to keep advancing. Thank you so much. I think we had this conversation as a starting point, but surely with an environment that promotes this discussion towards the same direction that we're interested in about improving society, having better impacts to everyone in terms of health and economic indicators for everybody. Thank you so much. I hope you have a wonderful day and that the content is of value to everyone. Thank you so much.
Muchas gracias por la invitación.
Thank you so much for your invitation.
Gracias, buen día.
You're very welcome.
Gracias,
Thank
buen
you. Have a
día,
great
adiós.
day.
Listo.
Goodbye.